Dobrý den, milí diváci, vítám vás u dalšího dílu rozhovorů s klinickými psychologi. A dnes je mým hostem můj kamarád Ingmar Gorman. Ingmar je Američan, takže rozhovor bude probíhat v angličtině a vy k tomu budete mít titulky. Hi Ingmar, thanks for joining me today.
Hi, thanks for
Hi.
having me. It's great to be here.
Yeah. So we've known each other for a long time, but I actually don't know what it is that you do exactly, and neither do our viewers. So if you could tell us a little bit about your job and what do you specialize in, and all those interesting details.
Yeah, sure. So I am a psychologist, a clinical psychologist by training. And I am currently in the role of actually a CEO of a psychotherapy training company. The company is called Fluence, and what we do is we train all sorts of mental health professionals, but we really focus on licensed mental health professionals. So psychotherapists, social workers, psychologists. We have many different kinds of professionals in the United States that can practice psychotherapy. And we train them in something called psychedelic assisted psychotherapy or psychedelic harm reduction and integration. Essentially, this is a way for clinicians, for therapists to be able to work with patients who have an interest in psychedelic drugs or are using psychedelic drugs, or psychedelics that are prescribable medicines.
Okay. So you do trainings, but you also have clients, I suppose, for therapy.
That's right. I still, I like to continue to have some exposure to private practice because it helps inform what I teach and what I develop. So I have about 4 or 5 private patients, but I used to work primarily in private practice and have a full caseload. I've also worked in hospitals and community mental health clinics. I really worked in in many different settings.
Okay, that's very interesting. And how is it in the USA with clinical psychology? What does it take to become a clinical psychologist?
So in the US, it is actually it's a quite long journey and it's quite selective. So first, a person has to have a bachelor's degree. So they go to a 4-year college. In the United States in general, that is a little bit more open-ended than it is in Europe or the Czech Republic, where usually somebody, when they go to a 4-year university or college, they've begun to really focus on what they want to do. In America, it's a little bit more, there's more variety. After the 4-year college, they then have to get a graduate degree. And if you want to be a psychologist, any kind of psychologist in the United States, you have to get a PhD. So if you have a 2-year master degree in psychology, that's not enough to legally call yourself a psychologist. You have to go through a 6 or 7-year PhD on top of your 4-year undergraduate. And the acceptance rates for universities in clinical psychology, it's been a while since I looked at it, but it's somewhere in the 5 to 2% of applicants get admitted to a PhD program.
Okay. Why is that? Why so little?
It's a good question. It's just a highly competitive field. I think there are different, a component of it, I believe, would be the number of mentors that are available, academic mentors to support the labs that are training psychologists. It's a larger, I think, infrastructural issue. But the thing to say is, so psychologists in the United States, there are different philosophies that different schools in psychology follow different philosophies. The one that I am most fond of is what's called the Boulder model, which comes from Boulder, Colorado, where there was a conference, I believe, in the 1950s that identified psychologists or clinical psychologists specifically as clinician scientists or practitioner scientists. So a training in clinical psychology under this model holds both the psychotherapy and clinical component to it, as well as a research component to it. You have to do research in order to get your degree. So I think there are many other professionals like social workers or licensed mental health counselors, or they're called licensed marriage and family therapists. There are many other kinds of degrees that are graduate degrees that allow somebody to do psychotherapy, but they aren't trained as scientists.
Right, right. How is it with diagnostics? Can you run diagnostics when you're just a psychotherapist, or do you have to be a clinical psychologist for that to be possible?
So everything I've shared so far is for clinical psychology is true across the entire country, but there is variety at different states in terms of who can diagnose. Psychologists can definitely diagnose. That used to be almost exclusive to psychologists and medical professionals.
Right.
But over time, in various states, you have some other professionals who can diagnose a psychiatric or psychological disorder. Maybe another point of differentiation for psychologists is when it comes to assessment, so psychological testing, that is one area where psychologists, for the most part, exclusively are allowed to interpret psychological tests. You can have people in training or other technicians deliver a psychological assessment, but it is only the psychologist that can interpret it and provide recommendations.
Right, right. And once you've become a clinical psychologist, what are you entitled to do? Like, what is it, what's your profession, or what's the application of your profession actually?
Yeah. Well, maybe I'll share just a little bit of nuance. So I introduced myself as a psychologist with a training in clinical psychology. So in some states, for example, in the state where I'm licensed, which is New York, the legal term is psychologist. There is no legal term for clinical psychologist.
Okay.
So I have to say I am a psychologist with training in clinical psychology. So that's one thing that I think is pretty true across the United States in terms of the role. Well, in terms of what I can do, well, psychotherapy, I can diagnose, I can interpret the things that we've already mentioned. I'm not sure if there's anything else that psychologists can do that I haven't mentioned. At least nothing comes to mind right now.
Right. And does it also mean that you can work in healthcare and outside of healthcare? Do you have this kind of separation? Because that's very much what we have here in Czech Republic, like some people are allowed to work within healthcare and others aren't. Is this something that's true also for US?
Yeah, one thing I actually realized as you asked me that question is that there are some states in the United States, not a majority of them, but maybe a handful, where psychologists can prescribe a medication. That is true, although it's not very common. Yeah. I believe Colorado is one of those states. In terms of healthcare, so this is sort of the difference between psychologist and clinical like a training in clinical psychology.
Yeah.
So the vast majority of psychologists in the United States, I believe if you put them all together, I'm not sure about this, but I believe that there are more psychologists without clinical psychology training than there are clinical psychologists. So if you're a psychologist, you've gotten your PhD, but you haven't done the clinical training component of it, you cannot offer health services like psychotherapy. You do need to have that, and that's governed by the Board of Professions within a particular state. So then when it comes to insurance, I think then there's maybe I don't know if you're going to ask this question, but
yeah, definitely. Thanks.
Generally, yeah. So if you are a if you have a training in clinical psychology, you have something called an NPI number, which is can't remember what that stands for, but it's essentially a number that can be identified across the entire country that is assigned to you as that you are a healthcare professional.
Mm-hmm.
And in terms of healthcare and insurance, the insurance system in the United States is very different than it is in Europe.
Yeah.
But
Mhm.
essentially, I can see patients. I don't have to accept insurance, but patients can come to me. I can bill them. They can then take the invoice and submit it to their private insurance and then get reimbursement.
Mhm.
Or I could be on what's called an insurance panel. So that means so the previous example is out-of-network insurance. In-network would be if I were on a panel with a large insurance company like Aetna or United, and then I'm almost like in-house or something like that. And
Mhm.
then the patient doesn't have to submit their invoice for reimbursement. They just get access to lower prices. And then I believe I, as the therapist, get some reimbursement from the uh, I'm actually second guessing myself. I believe maybe the patient pays me and then they get reimbursed from the insurance company.
Yeah,
That's how it
that's
works.
probably some kind of system, like some participation, right, between him, the patient, and this and the insurance company and you. Yeah, but what is then the motivation of people to go through this long process and end up being a clinical psychologist? Because it seems like it's hard. It's not for everyone.
Yeah, well, you have to really love it and be dedicated to it. And have I think it's very helpful to have a passion for a particular area of science.
Hmm.
So really, they're really, well, okay, motivations. Well, one is that generally psychologists purely are just paid more than other professions in terms of psychotherapy. Uh, Often psychologists find themselves in positions of administration. So, like in a hospital setting, they might run an inpatient unit, or they
Oh,
might be managing various um, mental health programs. So that they're
okay.
often kind of in that position if they're not involved in science. And then finally, really psychologists are there to generate new data, new science. So if
Mhm.
there's some area that they're really interested in and they want to contribute
Okay.
by writing papers, writing books, it's sort of that overlap between somebody who's doing mental health and providing those services and also moving the field forward.
Right,
Those
right,
are
right.
generally good places.
So the research part really is like somehow intrinsic to the profession, right? Is important.
It is.
Yeah.
Really is. Although there are many people who pursue a clinical psychology degree and get it, and then devote themselves to private practice and diagnosis, or
Mm.
like neuropsychological testing, not really do much science work. But the barrier of entry is that, and how the way that psychologists students are identified is
Mhm.
through their ability to generate scientific work. And different schools and universities will have different alliances. Like some universities, they want you to do the science, and then it's up to you what you do with your life. And if you do private practice or work in a hospital, that's fine.
Mm.
There are other universities where really the intention is that you do maybe 10% of patient work, and 90% of what you do is continuing this lineage of publishing and following in the
Right,
footsteps
right,
of your
right,
mentor and just building that
right.
body of work.
Oh yeah, I was going to ask about the ratio, if how much of your time do you have to dedicate, or do you dedicate to science and research, and how much do you dedicate to actually like the clinical practical work? Okay, so that's up to you.
Yeah, that's up to you.
Oh, good, good. And would you say that currently mental health care is available in the US, or are you also struggling like most countries in Europe are?
Struggling like most places.
Yeah.
I think that there are different barriers. I think in the United States, probably similar, that well, in a city like New York City, an hour of psychotherapy from a psychologist can cost anywhere between 150 to like $400 an hour. Um, So that's in New York City, though. I mean, I think that you could probably find this online on average. I mean, working with a psychologist in psychotherapy, you are talking probably about at least $100 an
Mhm.
hour. Um, Now, a licensed clinical social worker might charge somewhere around, it could go up as to that high, but maybe the bottom is somewhere around $50 or $75 an hour.
Okay.
And then it comes down to um, to insurance and who is willing to accept it. So I think we probably have similar problems to the ones that are in Europe, except that it's further compounded by the high cost of
Hmm.
treatment.
Hmm. And do you know of anything that, let's say, I don't know if I can say the government, but like some kind of body of authority is doing to help the situation? Would you know about it, something that's happening or?
Yeah, I mean, I'm not so well informed in the broader, my specialty is in the area of psychedelic therapy.
Hmm. Hmm.
But more broadly, there's a lot of discussion about bringing more support to psychotherapy and mental health. And lots of different organizations that are looking to really support people who are underserved in
Hmm.
psycho
Yeah.
and mental health. But I wouldn't say that we have found a solution. I mean, I think for me to speak about my area of focus, um, we've just recently had some pretty significant setbacks in my area of work. In particular, the American Food and Drug Association has uh, asked for more research to be done in the area of MDMA-assisted psychotherapy. But one of the benefits of it, at least that's been seen in the science, is that when it's being used to treat post-traumatic stress disorder,
Hmm.
after about a 3 or 4 month treatment period where a person engages in intensive psychotherapy and only uses MDMA in the therapy setting three times, we've seen about roughly 70% of participants in these studies who have chronic treatment-resistant PTSD for over an average of 15 years actually
Wow.
lose their diagnosis and be cured.
Wow.
And often that's permanent, lasting many years afterwards. Not for everybody, but for many of them, that's a permanent loss of diagnosis. And so that's the way that I'm kind of fighting this battle, right? Which is
Right.
finding more effective treatments for people so
Right.
that they don't need to be reliant on other medication, or perhaps don't need to be in psychotherapy for as long as they might have to. So that's the way
For
I'm fighting it.
yeah, for years and years, right?
Yeah.
Okay. Well, do you have anything you'd like to add? Maybe, like what is it that you think is good about the system, the educational system in the US, and
Mm.
what on the other hand is not so great? Like just in a few
Yeah.
words.
Yeah, I mean, I think that, I'm not so closely familiar with mental health training or psychotherapy training in the Czech Republic or in Europe.
Hmm.
But my sense is that this is my impression that at least in the Czech Republic, when it really comes to any kind of profession, uh, the schools are quite selective and the training seems to be quite rigorous. And
Hmm.
I think that's good. In the
Hmm.
United States, I'm very proud to be a psychologist because of not just the amount of work that it's taken, but also who we represent and how how carefully we were selected to be psychologists. And so I think that we often are level-headed, skeptical. We're not prone to just jump on any kind of new fad or just you know, be um, quick to judgment.
Hmm.
But one of, I guess, my concerns a little bit in the United States is that, well, the lower the barrier to entry for a psychotherapist or mental health professional, I think, less selective it gets.
Hmm.
And sometimes you do have clinicians and therapists who are well-meaning, but maybe are not as effective or potentially can, I don't know, unintentionally do harm.
Yeah. I think you could say that for almost any country, though.
Okay, probably. You're probably right. Yeah.
Ingmar, thank you very much for your time. And
Yeah,
all the best to you in the US.
thank you. You too. You're very welcome.
Bye.
Bye-bye.